Hello everybody, my name is Dr. Sebastian Ruhs. I'm the the Interim Chief Medical Officer at Chase Brexton and the Director of Infectious Diseases. I want to talk a little bit about COVID-19 and HIV today, since we had a recent increase in questions coming from people living with HIV, specifically about COVID-19. And I've reviewed some recent data that was released coming from CROI. CROI is a conference that is currently happening, was supposed to happen in Boston. It's happening online. It's one of the world's largest conferences with a focus on HIV. And so while we know from data mainly coming from China and a little bit from Europe how COVID-19 behaves, we know that people with immunocompromised conditions and older people are at highest risk. So let's look a little bit closer at what immunocompromised means. And so based on the data that we have available, it's mainly people who have pre-existing conditions like cancer, pulmonary diseases, cardiovascular disease. HIV in specific, there is no data that indicates at this point that someone living with HIV is at higher risk, especially if the CD4 count is within normal range and the viral load is undetectable. And so we're assuming that in this context, COVID-19 behaves similar than other viral illnesses that we're very familiar with, such as influenza. And so who do we have to worry about who is HIV positive? So those are people who have very low CD4 counts and are not on medications and don't have undetectable viral loads. So I think people who are falling into this criteria, they need to be more cautious than other people. And so what can we do to protect ourselves? And again, there's nothing specific that is different for people living with HIV than someone who is HIV negative. Some precautionary measurements that are really important and that have been shown to be effective is regular washing of hands. And washing hands has been actually shown to be more effective than using hand sanitizer. However, if a sink, water, and soap is not available, hand sanitizer is definitely a good alternative. Then what I recommend is that everyone make sure they are up to date with their vaccines, especially with the flu vaccine for everybody and someone who is HIV positive also with the pneumonia shots. While neither the flu vaccine nor the pneumonia vaccine protect against COVID-19, they can prevent that someone can get multiple diseases at the same time. And so I definitely encourage everyone to be up to date with their vaccines. I think those are the most important things that everyone should be aware of.